we ready to roll? Okay, all right. Well, good afternoon, everyone. I'll just begin before I pass it over to Dr. Morrison, but today is officially, I would suppose, the 9-week mark since the Chief Public Health Office and government started their around-the-clock response to COVID-19. I think, to say the least, it's been a Herculean response. It's been swift, informed, and I believe well delivered. A huge part of our response has been the accountability and the responsibility undertaken by Islanders from east to west, north to south, and all points in between, of course. I did have a meeting this morning with Dr. Morrison and Dr. Sabapathy, and we talked about many things, but I wanted to just take a moment to recognize all of the hard-working individuals behind the scenes. It came to me this morning in the meeting when Dr. Sabapathy said that many of the staff were running on fumes. And it hit me that these individuals, along with so many, have been working around the clock, 24 hours a day, essentially, for 9 long weeks. They do on-call shifts. They're doing webinars and media interviews and answering questions for local businesses and organizations and politicians, and all the while monitoring this invisible virus across our country and around the world with one goal, really, and that is to keep Islanders safe and healthy. So I know I've said it before, but Dr. Morrison and Marian Dowling have been the faces of our health response. They have inspired us, and they have informed us, and they have kept us safe. But I know that they are the first to admit that they are only able to do this because they work with so many teams of so many people and so many big teams of people behind them, and people who care. So I just wanted to say again that 9 weeks is a long stretch and there's a long way to go, but to all of those, I say on behalf of Islanders, thank you sincerely for your hard work. I also wanted to say that today is setting day for our lobster fishers. I certainly wish all fishers and their helpers on the water a safe setting day. I know that there's been a lot of uncertainty over the last few weeks for fish harvesters, and we have been advocating and working with our federal partners to ensure that there was support in place for them. And I was extremely pleased yesterday to see the announcement from the Prime Minister. That announcement is something that we have been working hard on and lobbying hard for, and it is very welcome news. I need to thank the Island MPs who have been really doing a lot of heavy lifting on this file as well. And also to the Department of Fisheries and Communities here in our province, who put together a very ambitious program last week for the industry as well. And a lot of people made this a reality yesterday. And as with all programs, there will be some questions, of course, and a need for greater clarity in the days ahead. But I do feel in my heart that fishers hit the water today with a greater understanding that both levels of government have stepped up to assist one of the key drivers of our economy. In speaking with that as well, I was very pleased to learn today and to hear the Prime Minister talk about the extension of the Canadian Emergency Wage Subsidy Program. It's no secret that I have been for weeks asking the Prime Minister and the Deputy Prime Minister on our weekly teleconferences that this program needed to be extended so that it could be fully supportive of our seasonal industries such as fishing, farming, and tourism. This extension will assist our key economic drivers to get the financial support they need for the summer season to help bring people back to work. And knowing that the revenues for many in these industries will be reduced, this program and having it extended as such will help reduce the expenses as well as to ensure that businesses are able to get through this season and start focusing on 2021. Today we're also talking about announcing a new case team program where post-secondary students will work in multidisciplinary teams to solve real problems brought forward by government departments and agencies, by private businesses, and by nonprofit organizations. These case teams are comprised of 5 post-secondary students. They'll spend 2 weeks working with an identified client, and the team will analyze the organization and its issues of concern. and research industry trends and best practices and developed evidence-based solutions. And at the end of the 2-week period, the students will present their findings and recommendations to the client in a professional report and also an oral presentation. And this initiative will create 25 new post-secondary positions for students in our province. Students will work primarily virtually to begin, but are required to meet as a group for at least 1 hour per day. And the case team coordinator for each will be available to provide advice and guidance to these teams. Students will also participate in professional development activities throughout the summer that will help further their educational and career goals. So through this program, students will gain valuable skills, including but not limited to presentation and communication, teamwork and collaboration, critical thinking, and problem solving. And I couldn't imagine a better time than right now with what we're dealing with in COVID-19 to have a group of talented post-secondary students helping to find solutions and to solve problems. So starting next Tuesday, these teams will be able to students will be able to apply for a position with the CASE team program, and businesses, nonprofit organizations, and government officials will be able to start submitting problems and issues for consideration to be part of the workload. It will start on June 1st with a 1-week orientation before they begin tackling the first case. So that's an exciting program for students. Earlier this week, I also participated in a Council of Atlantic Premiers meeting where we discussed opportunities for a Team Atlantic approach to our recovery. As Atlantic provinces, we're committed to working collaboratively to ensure a stockpile of personal protective equipment to make sure that is ready for any further outbreaks or second waves that we are anticipating. Most of this equipment will be procured locally from Atlantic Canadian manufacturers, including island businesses, and this will ensure that we keep as much economic development in this region as possible. We also spoke about the possibility of having regional movement within our provinces at a future date where self-isolation may not be required. And as time goes on, Dr. Morrison and her team will be considering this with our counterparts across the Atlantic provinces, but we're certainly not ready to commit to anything at this point. And finally, I just wanted to express my gratitude towards Islanders for their commitment to following the advice of the Chief Public Health Office. Today, you will hear Dr. Morrison outline updated plans and details of our Renew PEI Together plan, which will include moving the start date of Phase 3 from June 15th to June 1st. This is good news. This is a direct result of the great efforts of many, and it's all built on the fact that our trajectory has remained on the right path. On April 28th, we delivered and announced our plan. That was also the date of our last COVID positive case. Since April 15th, we've had only 2 positive cases and both are recovered. And as you know, all 27 cases are listed as recovered. We have not had a positive case in 17 days. In the process of that, we've expanded our testing to have what we believe is the broadest testing criteria in the country, and we have maintained stringent screening processes at all of our points of entry, and that will need to continue. And most importantly, as we continue to say, Islanders have heeded the advice of the Chief Public Health Office, and even though there has been greater movement of people within our province since the opening of Phase 1, Islanders are still being mindful, careful, and cautious. Dr. Morrison will outline what this means in greater detail in a moment, but essentially Phase 3 on June 1st will mean restaurants can open with restrictions, organized sports will start in smaller numbers, day camps can open, which we believe will increase the capacity for childcare for those returning to work, and speaking personally, gyms and fitness facilities can open, so and so much more. But of course, we keep saying that this is about maintaining this level of trajectory that we're on and to follow the same precautions that we have been undertaking for the past 9 weeks. In the weeks that have been COVID, we've learned a lot about ourselves. We've been measuring ourselves against other jurisdictions, and we also need to keep measuring ourselves against ourselves, remembering why we are in this situation, and not only how much work we have undertaken to get to now, but to be mindful of how much work we need to continue to undertake to keep moving forward. So with that, Dr. Morrison, I'll pass it on to you.
Thank you, Premier. Good afternoon. As the Premier mentioned, it's been almost 18 days since our last COVID-19 case here in PEI. We have no new cases since that time. We have 255 new negative tests since we were last here on Wednesday, and almost 4,600 tests have been performed in the last number of weeks. I know we're all missing loved ones in long-term care facilities, and they are missing you. Long-term care facilities have been asked and are looking into options for safely allowing visitation with residents, and that work is certainly underway, and more to say on that area in the next week, I hope. We recognize it's extremely important for everyone. And I know Health PEI regarding some of the visitor policies for acute care facilities are also being looked at. I did want to mention Health Canada has recently authorized 2 COVID-19 blood tests for use in Canada, but it will take time for those tests to get consistent, gather consistent information on immunity in Canada. We don't know yet if people who've recovered from COVID-19 will have ongoing protective immunity, how long that will last, or if it's possible for individuals to get COVID-19 infection maybe more than once. So widespread blood testing will determine the proportion of Canadians that may have antibodies, which indicates they've been infected with COVID-19, and it will help us understand immunity and the status. But this is going to take time, and it will be rolled out over a period of time. And so we recognize that waiting for all this science to come through is hard, but it's an important part of us understanding the pandemic and also how we use public health measures. So we'll continue to improve our understanding of COVID-19 in this country and how we adapt to it. I want to provide some further clarity on essential workers who travel frequently off-island for work, and we've had a number of questions in the last couple of days. So essential workers who travel frequently off-island for work, so they're going back and forth regularly. They will, and if they're tested for COVID-19, may be exempt from self-isolation. So essential workers include, but are not limited to, construction workers, healthcare providers, those employed in the transportation of goods and services, workers in the energy sector, fisheries and agriculture. Essential workers traveling off-island frequently within Canada or and the U.S. can be tested weekly for COVID-19. And the first time, if someone's going back and forth a great deal, the first time you're tested, you will be required to self-isolate while waiting for your test results, and then which will be important. And then if the test is negative, you will no longer have to self-isolate when you're at home. And note that none of these exemptions apply to long-term care staff. They must continue to self-isolate for 14 days. As the Premier mentioned, it was over 2.5 weeks ago that we announced the Renew PEI Together plan. And as we go forward in these, we're really still in the first phase of the plan, we continue to monitor and reevaluate. We're monitoring for capacity in PEI for contact tracing, our capacity in the health system, what the situation is in other provinces. And because of the position we're in, we're able to move ahead with the relaxation of restrictions carefully and cautiously. So next Friday, May 22nd, we'll be moving into phase 2 of the plan. And phase 2 will allow, with guidance, additional businesses to reopen to the service of the public. our child care providers to reopen additional non-urgent healthcare services and additional public health services. This would include our retail businesses, for instance. I know there's even discussions, and we've had a number of questions, and I believe the dentists are working with their association so that they may be able to offer further services earlier than the initial plan had indicated, but there'll be further details in that regard. And phase 3 was initially announced with a potential start date of June 12th. However, if things go well in the next week and a half, we'll continue to monitor the situation. We would like to move phase 3 up to begin on June the 1st. And phase 3 will include organized recreational activities, facilities, and services in public spaces. These would be aesthetic services, indoor dining, and patio dining. We'll have campgrounds are on the list, and I think it is about having us go a little bit faster to allow for movement and of people, and back to some of our activities carefully while maintaining restrictions at the bridge. To do this and moving forward, we will all have to work together to prepare for it. And so what does this mean? It means businesses, services, organizations will have to have an operational plan in place. It will be focusing on making sure there's physical distancing. They'll be focused on making sure processes are in place, screening, cleaning, hand washing. And then we also have to, certainly from our office, make sure we have good guidance documents in place. And so we're working on guidance documents for campgrounds, working with the restaurant industry they have good guidance documents in place, and working with them as well. The businesses may open only if they feel ready to do so, and I think that's important. And customers will also decide if they feel safe and ready. So I know this is exciting to look forward to, but I also want to be clear that there are still measures that haven't changed. And so these are the basic public health measures that we said are important right all the way through. And this is staying home when you're sick. We talk about the practicing physical distancing and washing our hands. And if you've traveled outside the province, self-isolating for 14 days. This is finding, we've talked about this new normal way of doing, of living, of working, and we do it thoughtfully. We talk about the importance of testing for symptoms, and we really, if people do have symptoms, it is important to be tested. And we've said it, and I know Marian has said it different times as well, but if you have new or worsening cough, shortness of breath or difficulty breathing, fever, chills, sore throat, we've always talked about runny nose and congestion, headache, muscle aches, unusual fatigue, and also acute loss of smell or taste. These are all symptoms for which testing for COVID-19, please call 811 or have your family doctor or nurse practitioner refer you to the clinic. There's been a lot of discussion around a bubble, and I think between Prince Edward Island and New Brunswick residents to travel back and forth. And we're looking, as the Premier mentioned, closely at this option as we look ahead to easing public health measures. We're not there yet, but as more work needs to be done, certainly with New Brunswick. And then, of course, with Nova Scotia, they will also be looking, if they're in a similar position at some point, we would look to having that ongoing conversation with them. Again, we're not there yet, but we're looking ahead and planning for what could be. If we can have some of that flow of people, potentially, it would be an opportunity for Islanders possibly to see loved ones in the Maritimes, and it would mean that there may not be the same period of self-isolation required. But again, that is for the future, but I mention it now to give people an idea of what we're looking ahead to. And I think along that same vein, we're getting questions and understandably feeling a lot of pressure, and I know many people are, about figuring out seasonal residents and others who have family who are planning to be here in PEI for extended periods of time. So we are looking at what that would mean, of course, self-isolation for 2 weeks, but trying to figure out what that could look like, and we'll talk more about that process in hopefully next week. The COVID-19 pandemic is a unique experience for each and every person, and there is no guidebook, and we've said that before. It's not something we've gone through, and we are navigating it cautiously as our priority continues to be protecting Islanders, especially the most vulnerable. We are making decisions for the right reasons to try to protect everyone. But it continues to be a balance between allowing more personal connection, reopening more opportunities for our island economy, and protecting that population. As we relax these measures, it's important we remain cautious and assess our own risks. Islanders have done such a wonderful job following public health measures, and this continues to be very important as we relax more and more measures. I know it can be a trying time and that we are all doing our best to adjust. But it is so important that in all aspects of our lives that we be kind, including those who we work with, how we speak to each other, the words we use, the tone we use, and let us be patient and calm and help one another. And by doing so, we will protect one another. We've used it a number of weeks ago, coming together while staying apart, and really, let's come together while staying 6 feet apart. So thank you and enjoy the weekend.
Thank you, and good afternoon, everyone. We continue to monitor health services that are delivered, especially as more services are happening in hospitals across the province. Our services reinstatement team is evaluating any services that will be reintroduced, and clinical operations teams from across the system have submitted plans to inform this multi-phased prioritized approach. Our response is working in tandem with the phased approach of the Renew PEI Together plan, with our focus on balancing what services can be safely reintroduced while maintaining capacity for a surge in cases or an outbreak of COVID-19 should we see that in the future. With respect to visiting guidelines that Dr. Morrison mentioned, our joint response team met again today and has made some changes for our hospital-based services and palliative care areas. We're happy to look at the continued lack of community spread and cases on PEI, so we will be increasing the number of designated visitors allowed for compassionate reasons and in specific areas of our system. Starting tomorrow, up to 2 designated visitors will be allowed for patients in palliative care, intensive care, neonatal intensive care, obstetrics and pediatric care. Additionally, we have increased the number of designated visitors for patients who are at the end of their life. 2 visitors are permitted per day, and those patients can also name up to 6 individuals who can rotate visits on a daily basis. This means that now different people can visit on different days. We're continuing to consider exceptions for compassionate reasons to our visitor restrictions, and these cases will be assessed on an individual basis by the executive leadership and administrative leaders for service areas within Health PEI. As Dr. Morrison mentioned, the visitor restrictions in long-term care remain in place at this time. To update you on our cough and fever clinics and the drive-through testing clinics, they continue to see patients both in Charlottetown and Summerside. Yesterday, we saw 44 patients in Charlottetown at our clinics and 17 in Summerside. A reminder that anyone who has those symptoms of COVID-19 to please contact your family doctor, nurse practitioner, or call 811 to arrange an appointment at the clinic. When arriving at the clinics, please remain in your vehicles until you're notified by staff to come in. I want to wish everyone a good long holiday weekend and thank Islanders for your patience and support of our healthcare system, and reiterate Dr. Morrison's comments of remaining being grateful for the situation we're in and being kind to one another. Thank you.
Thank you very much to both of you. And now we will go to our friends in the media for some questions.
Carrie Campbell, CBC.
Good afternoon, everyone. Happy Friday. I just wonder, first of all, whoever wants to pick this up, I just wonder what we need to see between now and June 1st to either allow this accelerated schedule to take place or that might prevent it from happening. And I'm also just wondering about the timing, because it seemed like there was time built into the schedule before to allow, I assume, for a certain amount of testing to happen before we move to the next stage. But this would compress that into, I think you have about 10 days between stages, and if that was a consideration in terms of kind of waiting to see the reaction from phase 2 before moving on to phase 3.
Hi, Carrie. And the answer is absolutely the testing is important, but we also have to look at what we've seen in our community. So I think the fact that we have come to this point in time and not seen evidence of community transmission despite testing and fairly broad testing, which will continue, I think it certainly makes us more comfortable to consider moving that phase a little bit more closer to the 1st of June. And then for us not to go ahead would be if we see all of a sudden in the next days ahead broad community transmission. Certainly that would be of concern if we start having outbreaks. We have talked about the fact here previously that if we were to identify one case or even 2 cases that were very linked to international travel, for instance, or even interprovincial travel where they were self-isolating and were not out in the community, so the really protected those around them, then that would be very different scenario than if we saw, a larger number or even some of those cases who had been out involved in different activities and going to different people's homes. So it will depend, but we'll be watching it. The testing clinics are open 7 days a week. We're screening asymptomatic people as well, people who do not have symptoms at the bridge, but also at the clinics if they're essential workers coming back and forth, as well as those who are ill, for instance, if they're going to hospital. And we've talked about that broad criteria for testing that we have here in PEI. And of course, these are, many of those criteria are similar to the rest of the country, but really we've been trying to do as much as we can to keep a good sense of what's going on here.
Thanks a lot. And I just wonder, in terms of the rules for phase 3, I think it's that the gatherings would allow 15 people indoors and 20 outdoors. I'm just wondering if those numbers are what you will be going with and how that relates with opening up businesses like restaurants and things like that.
So the gatherings, the numbers for gatherings are really for personal indoor and outdoor gatherings. So the numbers that we would use for businesses certainly need to be different. For instance, there are more than 15 people that need to go in and out of a business already at the grocery store. So they are a little bit different in that some of the businesses, people are coming and going as opposed to staying in one location. We are looking at that number, and I think what we're hoping to do is really talk about that anticipated number, even not on June the 1st, but later on, what that mass gathering number could be. We've talked often about that the definition of mass gathering will evolve over time. It will not get to hundreds, but it may get to 50. And so that will be something that we'll try to be confirming and working with over the days ahead.
Louise Martin, CBC.
Hi there. So I'm just wondering about, I saw today that the RCMP had shared a message that it has started patrolling the coastlines and waterways of PEI. How worried is the Chief Public Health Office, is the province about people potentially trying to get onto the island by boat?
I know that under the state of emergency and under that part of the order, it is about trying to protect the points of entry, but also really any potential point of entry, which could be various parts of, harbors, for instance. I'm not particularly worried. I think it's an important part of what we are doing and being careful for people because the reason is we want to make sure they self-isolate if they've come from somewhere else. I think we've not seen a lot of that to date, but I guess it's always good. We have a lot of islanders keeping close eye, I think, on our all points of entry, and I imagine they'll continue to do so as well.
Thank you. Then my next question is actually for Premier Dennis King. So the New Brunswick Premier, he said he's open to the idea of negotiating the opening of a travel corridor to allow Quebecers to get to the Magdalen Islands. I know you've been asked about this before, but I'm not sure you were up to speed on or up to date on what was going on. But the Parti Québécois MP for the Maggies has asked the Quebec government to come to an agreement to make sure that the right-of-way is maintained, potentially designated rest areas where people could stop to get gas and food. Is this something that PEI would consider, since people would have to cross through this province?
Well, hi, Louise, and thanks for the question. My senior staff have been in touch with the senior staff of the Premier's office in Quebec. As we understand it this morning, Quebec is looking at lifting some certain travel restrictions in certain areas. We have informed them that we wouldn't be in a position to want to do that just yet for travel between Quebec and the Maggies, other than what we do for essential travel right now. So I think I expect that won't be happening this week. For the Magdalene Islands. But as Dr. Morrison has said here, as we begin looking beyond and into the future, these are some of the issues we have to deal with. But as of right now, as I said on Wednesday or whenever the last time I was here, was that we're comfortable right now with what we have in place, and we would like to continue that for the time being.
Thank you so much.
Stu Meepy, The Guardian.
Hi, good afternoon, everyone. Question for Dr. Morrison. So you'd mentioned a little bit about discussions around sort of easing some of the travel restrictions for seasonal residents or people who are looking to stay for a lengthy period of time, family, that sort of thing. For tourism operators have been pretty vocal about this, but I guess the specifics definitely, they have a dollar value for a lot of people who are deciding whether to operate this season or not. So is it out of the question for these seasonal or long-term travel restrictions to be eased over the summer, let's say by the late July, for people from Ontario, Quebec, or the United States?
I think it's certainly possible that the restrictions could be eased in the sense that if they're going to be here for an extended period of time. But at this point in time, I mean, based on what we know now, the self-isolation requirement would still be in place. So if someone was coming for 3 weeks, really to spend 2 weeks and not be able to really do anything doesn't really seem to make a lot of sense. But if they were going to be, if they're seasonal residents and we're planning to be here for an extended period of time and had a good self-isolation plan in place, certainly that's what one of the things that we're looking at, and understanding that it wouldn't be just for those seasonal residents, but there may be other people who come back to PEI and because of family connections, and are here for sometimes 2-3 months or many weeks. And so that's what we're trying to look at, trying to keep Islanders safe, but recognizing that there are residents, seasonal residents, and people who have family here who do come for an extended period of time. And I know they don't want to put anyone in the province at risk either, and so they would have to self-isolate. How do we do that? I think we're trying to figure out, and I think trying to balance that, but the priority being on trying to protect our Islanders, but is there a way we can do that and ease up and let some of those seasonal residents return with certain pre-approval travel, et cetera?
Okay, and I guess just as a follow-up, I noted that for the phase 3 now, you talked a little bit about restaurants reopening, which now includes patio dining, which I don't think was on phase 3 before. So why the decision now to allow patio dining at this stage?
Well, actually, I think it was always just part of the restaurants. I mention it because some have wondered, well, do you do patios first and then in room dining? And so I just wanted to be clear it was all going at once. And so, I mean, and some of the interesting things around restaurants and the guidance around restaurants will be the tables having to be a certain distance apart from each other. So we'd expect, and that would be inside or outside, patios 6 feet apart from each other, only certain number of people at a table. There'll be a variety of fairly clear guidance on those expectation that when you take a reservation or you go to sit, that a name and contact number of an individual at that table would be taken, because then if there's a COVID positive situation and we need to do contact tracing, it would be the restaurant would help us be able to do contact tracing of their customers, for instance. So those would be a variety of things, but they would apply both indoor dining as well as on the patio. But I think it's earlier. It's a couple of weeks earlier than initially planned, and we want to make sure we mention it today because it gives businesses that extra time to make sure they're ready to go.
Okay, thank you.
Alex Sear, Global Now.
Hi, everyone. A question for Dr. Morrison, but you kind of touched on it with Louise's question earlier. Cottage season is approaching, and the virus appears contained on PEI as of late. So it might be reasonable to think that non-island residents will want to come to PEI at this time. So does that, along with the investigations around stowaway passengers coming to the island, motivate more stringent checks and border control?
Well, I mean, I think maybe the Premier mentioned that the Minister of Justice was looking into some of those allegations of stowaways, but I think you bring up an important point that really in the situation we're in now, without hospitalizations, without deaths, our cases are recovered, ongoing testing. I think people may want to come for different reasons to PEI, but right now our border measures are in place for a reason. It's we want to make sure people are coming because they're workers here. They are returning to island residents. There's some compassionate reasons that they would come, and if we go into a different stage where we're having long-term seasonal residents or people who are here for family for extended periods of time, that self-isolation period will be really key. And self-isolation does not mean going to the beach and being at your cottage. It's that period of time where if symptoms develop, we can test people. And what role testing has in that, certainly another question.
Thank you.
Thanks.
Rachel Collier, Eastern Graphic.
Hi, my question is for Dr. Morrison. And bringing it back to the 3 overdoses announced last week related to fentanyl, often police will announce deaths related to a cluster of overdoses like this. And I'm wondering, why has public health chosen to neither confirm or deny any deaths related to this situation?
I'm sorry, Rachel, I just missed a part of your question. I know I heard the first part was related to our cases last week, and it was whether we confirmed or...
Why the police didn't confirm.
Yeah, sorry, my phone isn't so great.
Sorry.
But it was just, why has public health chosen to neither confirm or deny any deaths related to this case?
Any deaths related to opiate or fentanyl as a derivative of opiates will be available on our website, and it's been up there for 2 years, and it's those are kept up to date on the website, but they are always dependent on autopsy results or not. So we wouldn't speak to an individual case here at this point in time, but that information will be confirmed as it always is, both in terms of the numbers of cases of opioid-related overdoses, including fentanyl, and deaths, and they are made public, but that is done in a process that that has been really approved through our Opiate Action Plan Implementation Committee and our surveillance experts on that group. So I think it's and in Prince Edward Island particularly, talking about 1 or 2 cases or 1 to 3 cases, it's a challenge because we really do want to respect people's privacy in terms of the overdoses not causing deaths and the overdoses maybe related to death. So that information will always be available at some point in the future.
Thanks so much for the explanation there. I have another question for Dowling. I'm wondering, are you able to share details about how the old Riverview Manor could be used in a COVID-19 response plan? I'm just wondering, what types of options does this building open up for you at this point?
Hi, sure, Rachel. We've been looking at it for a couple of reasons, and we have options that are based on the various scenarios we may face on PEI related to COVID-19. So we've been looking at it for additional capacity, bed-based care that could help support our community hospitals, and particularly for those islanders who are awaiting long-term care home placement. Another option that we are looking at it is for potential to be used as an outbreak unit to create capacity that would treat COVID-19 patients as well.
Thanks so much for the details. Have a good weekend.
Laurent Rigaud, La Voix acadienne.
Good afternoon. J'ai une question en français pour vous, Dr. Morrison. Au niveau du Canada, les navires de croisière sont interdits jusqu'au 1er juillet. Est-ce que vous pensez que, compte tenu des mesures d'isolement pendant 2 semaines qui sont en place aujourd'hui, on peut envisager qu'au 1er juillet, il y ait des centaines de personnes qui débarquent à Charlottetown de bateaux de croisière?
Bonjour Laurent, j'imagine que les traversiers ne seront pas ici. Je sais qu'à ce moment, c'est jusqu'à le 1er juillet, mais le premier ministre ici, M. King, ils vont parler avec les autres, le Transport Canada, Santé Canada, mais à ce moment, j'imagine que les croisières seront pas ici pendant l'été.
OK. Et j'ai juste une deuxième question sur les restaurants. Est-ce que les restaurants, quand ils ouvriront le 1er juin, est-ce que ce sera réservé aux résidents de l'île et aux membres d'une même famille, comme c'est indiqué sur le site Internet du gouvernement?
Bonne question, Laurent. Alors, les réservations pour les restos seront pas seulement pour les personnes de la même famille, mais vraiment, j'imagine à la limite 6 personnes par table. Alors, 6 personnes pour un réseau au resto. Je pense que peut-être j'ai oublié l'autre partie de ta question. Mais c'est plutôt ça que... et c'est pas seulement aux résidents de l'île du Prince-Édouard, c'est difficile d'en faire, mais on sait que les non-résidents seront seulement capables d'aller au resto s'ils ont déjà fini leur période auto-isolée pendant 2 semaines.
Merci beaucoup.
OK, merci. I just because I think it may, one of the questions in French was about cruise ships coming and the fact that at this point in time, they'd only been delayed till July 1st, but at this point in time, I know you'll be hearing more about with Transport Canada and Health Canada about that season, but I would not expect that cruise ships would be coming here this summer because the question was around self-isolation, but I would not expect them to be coming.
And just to add on to that, it did come up last night on the call with the First Ministers and with the Prime Minister, and we did indicate that we wouldn't be expecting or anything this summer here. So.
Thank you.
Merci.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you all. Ma question est pour vous, Dr. Morrison, en français. Est-ce que vous pourriez m'expliquer en français le raisonnement, le cheminement que vous avez fait pour en venir à la décision aujourd'hui de devancer la 3e phase de déconfinement pour ce qui est des restaurants, pour ce qui est des centres de conditionnement physique? Quelles étapes dans votre raisonnement ont été suivies pour arriver à cette décision-là aujourd'hui?
Bonjour. On regarde comme le nombre de cas qu'on a, le fait qu'on n'a pas de transmission communautaire évidente depuis beaucoup de semaines, c'est ici à l'île du Prince-Édouard. Et on regarde la capacité de faire les contacts, le contact tracing, la capacité au système santé. On regarde aussi si on est en train de faire encore les tests de COVID-19 et la capacité de faire les tests. On a encore les restrictions au pont et à l'avion et c'est très important. On a un programme pour faire les appels pour les personnes qui sont auto-isolées. Alors, il y a plusieurs faits. On regarde aussi qu'est-ce qui arrive les autres provinces. On a aussi, on n'a pas de voyage non essentiel qui même arrive des États-Unis. Alors, il y a toutes ces raisons ensemble. Et je pense que c'est aussi, on regarde l'importance de l'économie et puis je sais l'importance de bouger et de commencer les activités personnelles, mais aussi avec les organisations. Alors, toutes ces choses ensemble.
Merci. Puis, si je peux me permettre une petite précision aussi, avec le devancement de la phase 3, est-ce que vous êtes plus prête d'identifier une date pour le début de la phase 4?
Oui, je pense qu'on va voir. Ça dépend vraiment comment ça va aller, mais j'imagine que ça va être à peu près le 1er juillet. Mais ça change. Vous savez que ça change tellement chaque semaine, chaque jour, mais j'imagine à ce moment, c'est le plan.
Merci beaucoup. Bonne fin de semaine.
OK, merci. Bonne fin de semaine.
Merci, Francois. I think that will end today's news conference. I think with Monday being a holiday, that we will be back here with a news conference at 1:30 on Wednesday. So I wish everyone a safe and healthy long weekend, and especially to both of you, get out and enjoy it. So thank you.